taming was an Olympic sport. Our next guest would be head coach. A play-based therapy that teaches parents how to manage challenging behaviours in their kids is getting long-lasting results, even with children as young as 12 months old. Dr Jane Colhoff from the University of New South Wales School of Psychiatry joins us now to explain how it all works, along with Mum and her gorgeous little boy, George. Hello, everyone. It's lovely to see you.
Hello.
Jane, we might start with you. Can you explain how parent-child interaction therapy actually works? What's new about it?
So, the beautiful thing about parent-child interaction therapy is it actually works with the parent and the child together. It's all based around play. So children learn best when they're playing. And so in our therapy model, the parent and the toddler are together in a playroom with lots of lovely toys. But the therapist is actually watching from behind a one-way mirror, providing the parent with coaching, so the parent will be wearing a earpiece, and they get lots of lovely in-the-moment feedback about what they're doing with their child, and tips and suggestions about how they can manage some of those really difficult behaviours that sometimes arise in toddlers.
And Dallas, I'm in the middle of something similar with my daughter. We've gone from the terrifying 2s to the downright threatening 3s.
Yeah.
You've got your little George. Did you feel like there was something about his tantrums that were different, that they were worse than any other toddlers, that they were not normal? What made you want to go and get help?
I think my daughter didn't react the same way George did to a lot of different stressors in her life. So when George kind of freaked out a little bit more, had bigger tantrums, it became kind of more obvious that maybe I needed help to help guide him through some of those bigger feelings and stuff like that, where I didn't have those struggles with his sister. So we sought out some help and we found this great program, didn't we, bud?
Jane, is there any such thing as normal toddler behaviour? It seems that there seems to be no rhyme or reason when it comes to toddlers. And what do they say? You should never negotiate with a terrorist?
I think that's a really good point. I mean, there might be the odd toddler out there that has never had a tantrum, but the great majority of children, 1-year-old, 2-year-olds, they're having tantrums regularly, and it's actually completely normal. It's a part of their development, They've got to this point where they're starting to walk, they're starting to have new words, being able to assert their independence, but all at the same time, they still need a lot of help with managing their behaviours and their emotions. So it's really normal.
What are some of the biggest mistakes that parents make when it comes to taming their toddlers?
I think the thing that's really important to remember, and what this program does, is it's all about thinking about tantrums in a slightly different way. So in a child who's under 2, they're not deliberately trying to get their own way or manipulate their parent when they have a tantrum. They're simply having a really big emotion that they might not even understand or know what it is, and they definitely need some help managing it. So parents need to be able to, view a tantrum in that way, and then come and help their child navigate their way through that emotion.
So don't see it as bad behaviour, see it as big emotions that need to be managed with a bit of love and care.
Yeah.
And Dallas, what was the biggest thing you took out of this? What were some of the tips you learned about how to manage them? And I really, really desperately want to know.
Same.
I think the biggest takeaway for me was just identifying his feelings for him and helping me describe his bigger emotions to him. So it sort of helped make him feel a little bit more in control, having somebody help explain those feelings. And I think it's something we still do now when he's sort of starting to get really overwhelmed. We'll say, oh, but I see you're really frustrated because, and just trying to help guide him through those bigger feelings.
So when he's sort of exploding with rage or whatever, and might not even know, which is how I feel most of the time actually, but might not actually know why he's angry. What you talk through him and say, okay, you're just tired, or you're hungry, or you just want this, and explain things to them. Actually tell them what they're going through. Or
he obviously feels out of control, which is probably quite scary for him, like you or I would feel. So we say, oh, look, I know you're upset I took your car. I took it because this, and I know that makes you feel a bit sad. And then, it doesn't just switch the tantrum off necessarily, but it definitely helps bring him back and probably mitigate a lot of me losing my mind in the moment, as well as him sort of escalating from there. It helps sort of stabilize the situation a little bit easier.
Jane, it all sounds very good in theory and easy in theory, but toddlers often choose very inopportune moments to absolutely lose it, like in the middle of a supermarket. How can parents keep their cool? Because it's often when, you know, you're struggling with the groceries or you're trying to buckle the other child into a car seat that they absolutely melt down. What are some tips for parents to be the adult and stay in control of their emotions in order to help their toddler manage theirs?
Yeah, really great question. And I'm a parent too, so I've been through this. I know what it's like in the supermarket, wherever you might be. I think the really important thing is to just remember what the child's going through and not to try and keep your cool, like you say, and use the same emotion regulation techniques on yourself. You know, talking to yourself, I can do this, my child's not being bad or deliberately trying to do anything embarrassing for me in the supermarket right now. He or she's just having a big emotion and he needs my help. So just talking yourself through it. Sometimes taking some big breaths if that's what you need as well, just to keep you relaxed. And like Dallas said, when you're actually using these techniques to try and help your child, it gets you out of your own head often and helps you manage your child. And
Jane, I was going to ask, a lot of two-parent families, certainly mine, there's the soft parent and the hard parent. I'm the one who's always trying to appease the child and do whatever it takes to make that anger go away. My wife is always telling me off as well and saying, no, you've got to tell them no, you've got to say discipline. Oh my God, that's triggering. That's my daughter there just screaming because I haven't tied her hair back properly. Or because someone else is dancing in the house and it's her dance floor. And I'm sorry, darling, we'll tell everyone to stop dancing. It's okay. Just don't make that noise. Is it more important to set boundaries and discipline, or is it more important to be empathetic and just give the child basically whatever they want?
I think it's a really good point. Sometimes with older children, there's definitely a place for setting boundaries, and children need limits and they need to know where the line is, and they need their parents to help set that for them. But for these really young ones, so we're talking, you know, a child who's between 12 and 24 months, I don't think punishment or discipline is really going to help them in that moment of extreme big emotion. What they really need is their parent not to move away from them, but to come in and really help them with that emotion.
For more information.
So it's different for the younger ones.
Gotcha.
Yeah, for more information about parent-child interaction therapy for toddlers, you can head to karatani.com.au. Dr. Jane Kolhoff and Dallas and George, thank you so much for joining us.
Thanks, guys.
Thanks so much.